Midst of trying to overcome one virus, another is arising. A respiratory virus that usually affects children is on the rise. Center for Disease Control warning southern states about all this. 5 News reporter Zoe Henry joining us live with more about this. Zoe?
Darren, that virus is usually called RSV or respiratory syncytial virus, and doctors usually see an uptick in cases around October because the weather is getting a little colder, but they're seeing rising cases right now. Last year, RSV cases plummeted because of sheltering in place, social distancing, and other pandemic restrictions. As those precautions were lifted, RSV cases began to increase. On June 10th, the CDC issued a health advisory for RSV in southern states, Arkansas being one of those states with rising cases.
Prevention is the key. And so how can we prevent all the same good hygiene measures that prevent COVID, that prevent influenza? They would prevent RSV too, as we saw this past winter. And now, especially for people that are have people in their family that are in those age groups that are most at risk for severe problems with RSV, infants or elderly, it would be good to take those measures again.
Dr. Tomlinson also says the uptick in cases is unusual for this time of year, but isn't outdoing what the numbers are reported in December for the normal RSV season. I'm live in Johnson, covering news where you live. Zoe Henry, 5 News.
All right, Zoe, thanks. Symptoms of RSV similar to cold symptoms, but can become severe, especially in infants and in the elderly. Be sure to monitor any breathing issues that may develop in addition to cold-like symptoms.